is around the corner. In fact, Jody has been talking about the warm-up at the end of the week, and that means increased sun exposure and an increased risk for skin cancer. And here to talk about the dangers of too much sun and what you can do about it is Dr. Melanie Palm, the director of the Art of Skin MD, a center based in Solana Beach.
Thank you for having me.
Thank you so much for joining us today. All right, so a lot of us here in San Diego love the sun. Talk a little bit about the prevalence of skin cancer.
Sure.
and really how the sun can be a detriment.
Well, it's pretty amazing. So skin cancer is the most common form of cancer, and it's not surprising the skin is the biggest organ. And I think the one that we really as dermatologists get concerned about is melanoma. So this past month was Skin Cancer Awareness Month. Approximately, depending on the source you use, about 80,000 to 160,000 people will actually be diagnosed with melanoma just in this year alone. So it's something that I'm really passionate about. I think a lot of dermatologists are. I just had 2 new melanomas in the last month walk through my clinic. But the good thing is we're finding it early, so we can talk about some of those things.
Yeah, I was looking at some of the research. That type of cancer has actually, the numbers have risen over the past few decades.
Yeah.
Why is that? We're showing a picture. We're going to show a picture of it right now so that people are aware of what it looks like.
Sure. Well, we know about 80% of melanomas are related to UV exposure and tanning beds. So one sunburn in your life or one tanning bed exposure in your life actually doubles your risk of melanoma, which is shocking because I think a lot of us had made little trip-ups during adolescence or during college years. But there's a lot that you can do to prevent things. We're in a sunny climate. We're good about applying sunscreen, but sometimes reapplication or avoiding peak hours is a real problem. And then doing really good skin checks. So I often tell patients, even though it commonly occurs in areas like your back or the calves, it can happen where the sun doesn't shine. You can get melanoma in your scalp, between your toes, sort of, on your bum as well. So you really need someone checking areas you can't watch. Check yourself once a month and have a board-certified dermatologist look at you too.
Okay, we're going to put up a full screen if we can right
Sure.
now of some of those tips. What type of sunscreen should we be applying and how much? We always are hearing different advice in terms of the type and maybe how much you should be putting on your body.
The American Academy of Dermatology recommends a broad spectrum. So that means covering UVA, which is related to melanoma, UVB, which is related to burning, and then having an SPF of 30 or more, which sort of denotes the coverage for UVB. We really tend to prefer sort of physical-based sunscreen. So I tell patients I like something with zinc or titanium, the ones you can actually pronounce, and you want to reapply frequently. So with heavy activity, a waterproof or water-resistant one, reapplying that about every 60 to 90 minutes, depending on your activity.
Okay, and how much?
About SPF 30, and the amount that you apply, think of an ounce. So that's good for full body application. That's like a shot glass. That's an easy way to sort of recommend. So your typical sunscreen bottle is only 4 applications. So if you're using 1 bottle for the whole summer, you're under applying a lot.
Wow, okay. Check with your physician every year and also examine every month.
Absolutely. Look for the ABCDEs: asymmetry, border, color change, diameter. Most important is evolution. So if something's new or changing, is your ugly duckling, the spot that just doesn't match the rest, come in and see your dermatologist.
Okay, great advice. I'm sure everybody should pay attention, being that it's